Hi. Good day. You are welcome to today's lecture. And today we're going to look at drugs. We're going to talk about drugs. And it's one of the things that we are going to deal with a lot on the field. So that is what basically we are going to look at today. Introduction to drugs. As far as possible, we talk about everything you need to know about drugs, how to give drugs, how to understand drugs, names of drugs, quite a lot. So I hope you enjoy the lecture. My name is Prince Asando Mensah, a registered nurse, and I'm your lecturer for today. What are drugs? In simple terms, when we talk about drugs, what are drugs? Is it when we talk about drugs, are we talking about paracetamol? Are we talking about cocaine? Are we talking about the tabia herbal bitters? What are we actually talking about? Anything that we use as medicine, anything that we take in with the notion of curing a disease, or actually bringing down the effects of a disease on the body, or preventing a disease, can be called a drug. So any substance or mixture you want to use it to either cure or mitigate that bring down the effects, or actually prevent a disease, is called a drug. And a drug could be food, it could even be water, it could be herbs, could be nicotine, caffeine, paracetamol, even the things that we use on our body, the creams that we use on our body, aspirin. There are lots of things that we can classify as drugs. That is why we advise everything you use, you should use it. You should actually read the content very well, because you don't know what you are putting on your body, or putting in you or in your body. We are going to look at drug names. It's one of the things that you're going to play with on the field. The names of drugs. Someone will say, wow, we know the names of drugs, we know it's aspirin, we know it is paracetamol. No, unfortunately, drugs are like human beings. They also have three names. One, when you are coming, you came with your name. You came with a name. That's the name that you were born. So the fancies call it Okrada. So when you are born on Monday and you are a male, they call you Kojo. When you are born on Wednesday and you are a female, they call you Equia. Then your parents will also choose to give you a name. Your parents will also choose to give you a name, and that name will basically have your father's name attached to it. It's also your name. Then the some tribe will also give you another name, which is actually a name you are mostly named after one of your ancestors, or someone who is still even living. So every person have three names. So you have what your parents gave you, you have what you came with, and you have uh, what whom you were actually named after. So you have three names. The same way drugs also have three names. They also have three names. It is interesting. One of their name is the chemical name. We also have the generic name. We also have the trade name. We will talk about all these names, and we will learn what to use and what not to use. Which of the names are you supposed to use? Which of the names are you not supposed to use? When are you to use the names? Let's see. So we are first going to talking about the chemical name. The chemical name is the scientific name that actually describe the structure of the drug, the atomic and the molecular structure. Actually, this describe the structure. It is mostly used by scientists who actually make or play with these drugs. So a drug like a name like RS242 methylpropanoic propanoic acid. How this is the name of a drug. Can you imagine that you want to go and buy a drug from a drugstore? You're like, I'm buying RS242 methyl propylphenol propanoic acid. Before you finish mentioning the name, I'm sure your sickness will be gone by then. So we don't normally use it. We leave it to the scientists who normally want to play with it. If a scientist sees this, he actually knows the composition of the drug, what is actually in the drug, what is everything, basically what the drug can do or this or that. Well, but everyday use, we cannot be using some of these drugs. So we don't use chemical names. We leave it for the scientists. That's one of the names. I don't know which of the names of human beings that you can link it to chemical names. Is it the name of your ancestor, the name you were given by your ancestor? Sometimes some of these, the names that if you are named after your ancestor, some of these names are very heavy. Not everybody use that name anyway. So we can say that that name is a chemical name anyway, just an analogy. Then let's talk about the generic name. The generic name is actually the simpler name of the drug, because the chemical name is very, very cumbersome and very difficult to use for everyday life. We have an abbreviation of the chemical name, and normally that name is given by the original manufacturer, the first person who actually brought the medication into being. So that's a generic name. We can say that generic name is the day you were born with. So you come and it's a simple name, Kwesi, Kojo. You were born on Monday, so you are male, so you are Kojo. So we don't want to burden ourselves with a whole lot of things. So they just abbreviate the chemical name to form, mostly they all just abbreviate the chemical name to form the generic name. The generic name, so this is how it is. For a drug like, example of a generic name is paracetamol. Paracetamol is a generic name. So and that name was given by the first person or the first company that actually brought paracetamol. But every company can also make paracetamol. So if you make the paracetamol, you can also put, if you make that drug, you can also put the name paracetamol on it. That is the generic name. We also call it non-proprietary name. That name doesn't belong to anybody. If you say paracetamol, it doesn't belong to anybody. Every company can use paracetamol, can use the name paracetamol. But in the health sector, this is the name you want to use, the generic name. When we go to the next slide, you understand it more. So let me move to the next slide. The trade name is also called the brand name or the proprietary name. This drug is given to it by the company making the drug. So let's say someone brought a drug and named it paracetamol. Now everyone is making the drug. Company A is making the drug paracetamol. Company B is making the drug paracetamol. Company C is making the drug. Maybe NS Chemist is making paracetamol. Tobinco is making paracetamol. Oson's Chemist is making paracetamol. They cannot all put the name paracetamol on, or only paracetamol on it. How will you know that this one is for NS Chemist, or this one is for Oson's Chemist, or this one is for Tobinco? So we have the name you call the trade name, or the brand name, or the proprietary name. It all means the same thing. So what it does is that Tobinco can say that Tobimor, so that that is the brand name, Tobimor, the brand name here. So he said that for my paracetamol, I call it Tobimor, so that when you go to the pharmacy or the drugstore, you are giving, you say you want paracetamol, you are giving Tobimor, you get to know that this paracetamol is from Tobinco, and they've named it Tobimor. Maybe NS Chemist will also call it Enamor, so that you get to know that this paracetamol is from Enamor. So that is the trade name. The trade name actually is sometimes used in the health sector, but we don't want to use it. Why? Because it's when you generic name is widely known. Generic name is widely known. So when you mention paracetamol, everybody knows it. But let's say when you mention Tobimor, probably when you went in Accra, Tobimor is very common. But you go to central region, there is no Tobimol there, but there is paracetamol there. When you go there and mention Tobimol, most people may not know Tobimol, so it is always best to use paracetamol. That is widely known. So when a medical person asks you for the name of the drug, they want you to mention the generic name. It is normally written, the brand name is actually larger, and it is in boldly written on the pack of the drug, but the generic name is actually, sometimes after the brand name they write the generic name under it. That is the actual name of the drug. If you want to know the difference between, if you take a drug, if I don't know if you have drugs around, you can take the pack of a drug, you see that the difference between the trade name and the brand name, or how you're able to see, is that the trade name has a symbol R not. If you look at point 4, I see the symbol R is normally written after the trade name, that is registered. But the generic name, you don't write any registered sign. There's no registered sign against it. So these are the names of drugs. So we've given you example. Mebendazole. Mebendazole is a generic name. We take mebendazole a lot. It's for worms. We use it against worms. So this is the chemical name: N6 benzoyl 1H benzimidazole 2YL carbamic acid methyl ester. This is a chemical name. I don't know whether you just need a common dewormer and you just go to the pharmacy and you have to mention N6 benzoyl 1H benzimidazole 2YL carbamic acid methyl ester. It's quite long, so we don't use it. We leave it for the scientists. But we have several mebandazoles. So Vemos, I know some of you have heard of Vemos. So you can see that I'm buying Vemos, it's actually mebendazole. You can say I'm buying Telmin, it's actually the same mebendazole. You can say I'm buying Mebendaz, it's actually the same mebendazole. So they all actually mean the same thing. So it is best to use mebendazole, so that when you go to the pharmacy and there is no Vemos, the pharmacist can still give you Telmin, because they are all the same drug. I don't know whether you've been to a pharmacy, you mention the name of a drug and the pharmacist tells that we don't have some, but we have another one which is the same drug. They are actually saying that they are saying that the drug you mentioned, probably you mentioned the brand name, but it is actually the same probably you mentioned Vemos and you said, oh, I have Telmin. It contains the same mebendazole, nothing wrong with it. We also have ampicillin. I'm not going to mention the chemical name. It is there. I think you can mention it. So that's the generic name. But the trade name, we have some companies that have made ampicillin, and there was some call it Omnipen, some call it Principin, some call it Tutacillin N. But it's the same ampicillin. For example, paracetamol, the Americans call it acetaminophen. So the chemical name is there, which we don't use. In Ghana, you can have Letap. Letap is paracetamol. Tylenol is the same paracetamol, and Panadol is the same paracetamol. So at times when you hear someone, oh, when I take Letap, it doesn't work for me, or I don't want Letap, I want Panadol. I always say that it's the same drug, whether Panadol or Letap is the same drug. But at times, some doctors or medical people will want to use a brand name. Why? Because some brand names, some companies actually make quality drugs. Sometimes some also make fake drugs. So you want your patient to take a quality drug, and you know a quality brand. So for instance, maybe if Letap is a quality brand, instead of writing paracetamol, the doctor will write Letap. So that means that he specifically wants Letap. He doesn't want any form of paracetamol. He doesn't want Tylenol. He doesn't want Panadol. So it depends. At times we can use trade name, but most often it is ethically good to use brand name. There's also another drug, ibuprofen. It's very, very common. Ibuprofen. That's the generic name. This is one of the drugs that the brand name is very very common. One of the brand name is Brufen. That, or the trade name is Brufen, and we all call it Brufen, but the generic name is ibuprofen. And the Brufen is a brand name. It's just a company. That's why you go and buy the drug. You don't see if you say you want Brufen, but you don't see Brufen written on it. But you see, you rather see ibuprofen written small, written on the pack. There was also another brand name, Motrin. There was also Dolgate. I don't know whether you've gotten the explanation I'm trying to put across. So these are the three names of drugs. Drugs have three names, and we have the chemical name, which we leave it to the scientists. We have the generic name, which is commonly used, and we have the trade name, which is normally given by the companies that make the drug. Let's look at where drugs come from. Where does drug come from? Someone will say that I only, for drugs in the pharmacy, it's full of chemicals, so I don't take drugs in the pharmacy. And someone will say that oh, for herbal drugs they are natural, so natural, so I will take herbal drugs. Today we are going to look at where drugs actually come from. We have three drug sources. We have the natural, we have the semi-synthetic, and the synthetic. Natural sources is when the drugs are actually derived from plants, animals, and minerals. So we have drugs like atropine. Atropine is used in the hospital a lot, mostly at times. Let me not go into the details of it. We have caffeine. Caffeine have in a lot. Coffee contains caffeine. You have nicotine. You have digoxin, cod liver oil, insulin, iron, and iodine. Some of these drugs all come from natural sources. You have synthetic sources. These are drugs made in the laboratory. Example: paracetamol is actually made in the laboratory. Brufen is made in the laboratory. Metronidazole is made in the laboratory. And we also have drugs that are derived chemically from modifying natural substance. So they are natural substance, then they modify it to become drugs. So it is like, we call it semi-synthetic drugs. So we have some of the antibiotics: ceftriaxone, ceftriaxone, ampicillin. They are all semi-synthetic. Let's see how drugs are given. How do we serve medication? How are medications given? Medication can be given through your mouth, that is orally, or in the mouth. And the mouth, we can talk about buccal, sublingual, and translingual. We will talk about each of them. Let's say oral, that is swallowing it into your gastrointestinal system. I believe now, when I mention gastrointestinal system, I believe you do know it because it's an anatomy. So, and we say that is the safest, and that is the one that we all do it. Even the patient can do it. You give the drug to the patient, he can even put it in the mouth and he swallows it. So it's the safest, it's also most convenient, and it's least expensive. You don't need to go and buy any special device to deliver the drug. All what you need to do is to give the patient, for the patient to take it. The only thing is that if the patient cannot swallow very well, the patient cannot take oral medication, or the patient is unconscious or semi-conscious, it's not advisable that you give the patient oral medication. So drugs are administered to patients who are conscious and can swallow. Oral medications are given to patients who are conscious and can swallow, who can follow through command. Sit, you can sit. Do this, you can do. If the patient cannot follow through command, please do not give oral medications. Then we have drugs that are given buccally. Buccally is when it's given between the cheek and the gum. We put the drugs there. The drug will be there and it will melt into the blood. We also have the sublingual, that we put the drug under the tongue. We also have translingual, when the drug is put on the tongue to melt. And this type of drug administration is very very fast. And the drug absorbs very fast and goes straight to the blood, and it works fast. For instance, when someone is having an angina or problems, it's when there's pain, when there is lost inadequate blood supply to the heart. It gives you pain in your shoulder. When some of these things happen, you are administering aspirin. Or when someone have most heart related things that we normally give aspirin. We normally advise that you put the aspirin under the tank. It moves to the blood as quickly as possible, and it's very fast. It is faster than letting the person swallow the aspirin. So these are buccal, sublingual, and translingual. We also have the rectal and the vaginal route, and we have some drugs that are mainly used, or we serve it through the rectum, your anus, or we serve it through your vagina. So they are suppositories, cream. At times they are ointments or cream, gels and tablets, and they are put there. So some gels, some suppositories, and some creams and some tablets are actually instilled to treat local infection or irritation. And we also have the topical route. Topical is when normally put on the skin. Where we have some rashes at your back, you put some cream there. That's a topical administration of drugs. So some drugs are put topically. Normally for skin, when you put an eye drop, we say that it's a topical. So eye drop is a topical. If you are putting a medication on your eyes, it is topical means of administration. We have ear drop, the otic, the nasal preparation. They are all topical means of drug administration. So we have other drug administration, other routes of drug administration, intradermal, intramuscular. We are not going to talk much about it. For the oral and sublingual and the topical and all those things we've talked about, when we come for the practicals, we are going to learn how to do it. We are not going to learn how to give injection. Probably how to give insulin injection. We may take you through, but we are not going to learn how to give injection. So intradermal is a type of injection that we give just right under the skin. We have a way of turning the needle to give intradermal. Intramuscular is when the injection is given deep into the skin. That's intramuscular. The intravenous is when the medication is given through the vein. We are not going to learn all these things because you are not allowed to do so. And subcutaneous is also a type of injection that the needle doesn't go very deep, or it is inclined or slanted, and the injection is actually given. As I said, we may not be going through all these things. We'll be doing the oral and the topical, sublingual, buccal, and mode of drug administration. So we have the respiratory, when drugs are actually turned into gases and you have to inhale it. At times you may end up giving asthmatic patients, you may end up nebulizing them. We call nebulization, nebulizing them at home mostly, but mostly it is done in the hospital. You have the gastric route, that is, this will allow drugs to be instilled, or direct instillation of medication into the GI system of patient who can't ingest the drug orally. So at times there is a tube on the stomach that the drug is pushed in and goes through the stomach directly. So all these things we are not going to learn it because you are not allowed, you don't have the regulatory license to actually do some of these procedures. This is to help you know that there are other ways of administering drugs, except oral, the one that you are going to be taught the practice. So what is your role in drug administration? One, one of your responsibilities is to educate the person, education of the patient about the drug. So you have to know the drug, what the drug does, whether there are side effects of the drug. You also have to serve the right amount of drug the doctor actually prescribed. And you also have to make sure that your drug, you are serving the right drug, you are serving the right drug to the right patient at the right time. Drugs are actually served on time, and you are serving the right amount, that is the right dose. If the doctor says that serve 500 milligrams, you are serving 500 milligrams. If the doctor says serve one tablet, you are serving one tablet. And you are also giving at the right route. If the drug is supposed to be swallowed, you have to make sure it is swallowed. If you are supposed to put another tank, you have to make sure it is put another tank. So this is also one of your responsibilities. Another responsibility is also serving drugs. Serving drugs. It is your responsibility to serve the drug. Your responsibility to serve the drug. Then also assessing the patient during the drug administration process. So when you are giving your patient medication, you have to make sure that your patient, you have to check your patient or observe your patient to make sure that after taking the drug, the patient's behavior hasn't changed, or the patient is not acting weird, or the drug is not having any bad effect on him. You also have to look for any side effects of the drug. So these are some of your roles, some of the roles that these are some of the roles of a caregiver when it comes to drug administration. So this brings us to the end of a very long lecture. That's about this. That's about 25 minutes in, 25 minutes and more, and we learned about drugs, what drugs are, their names. We learned that they have three names: chemical, trade, and generic names. We learned where drugs are from, and we also learned about how drugs are given. Then lastly, we also talked about how we can our roles as caregivers in drug administration. Your questions and contributions are welcome. Thank you.